Watch tonight, post-COVID heart concerns.
WGN medical reporter Dina Bair has more on the latest recommendations when it comes to young athletes.
Doctors are seeing heart problems, mostly in older patients hospitalized with the virus. But what about young athletes? When a University of Florida basketball player collapsed months after a reported COVID-19 infection, the case reignited concerns among parents and fellow athletes. Cardiologists say there is a key factor to help determine when more testing is needed.
My entire life, since I could walk, I've been super active.
A three-sport athlete in high school, Sarah Barbosa kept up her rigorous exercise routine in college.
I was going to cardio hip-hop classes. I would be working out most days of the week, running the treadmill, running outside. I was doing the machines.
But in early November, she came down with COVID-19.
I woke up with 102 fever and then this crazy pressure in my head and throughout my neck and back. And I had my fever for 4 days straight. I couldn't break it. I had the cough, the runny nose.
When she returned home weeks later for the holidays, there were signs the fit 18-year-old was still struggling.
She was bringing up her laundry basket, maybe 5 stairs, and her heart was racing. She was out of breath and winded from bringing a laundry basket up.
I was like, Mom, like, feel my chest, and my heart's like thump, 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 crazy, and it had never happened before.
So for me, that's when I think it became a little more concerning.
The Barbosas aren't alone.
You could see this red and green line.
North Shore University Health System cardiologist Dr. Jason Robin says during winter break, he and his colleagues have seen 75 to 100 high school and college athletes concerned about post-COVID myocarditis. That's inflammation of the heart muscle.
We certainly have seen an uptick in the number of calls since the University of Florida basketball player collapsed.
Dr. Robin says the risk for myocarditis does appear to be linked to severity of infection.
But for the most part, what we've seen to this point is asymptomatic and mildly symptomatic young people do very, very well, and there's really no concern for clinically relevant myocarditis.
But for those who had more than mild symptoms?
When you're talking about athletes who have had any sort of cardiac or pulmonary symptoms, chest pain, shortness of breath, or they have had persistent fevers or significant muscle aches, and that's the group that should be evaluated before they return to playing sports.
The recommended heart tests are an electrocardiogram, also known as an EKG, to look at the electrical activity, a troponin blood test, a marker of inflammation, and an echocardiogram or ultrasound. If there's evidence of myocarditis,
we recommend that the athlete does not participate in any strenuous activity for typically 6 months.
I didn't want her to be one of those kids who just all of a sudden something happened to.
What we're looking at here is an ultrasound of the heart, and when there is inflammation of the left ventricle, that's when we're concerned that there could be arrhythmias of the heart, really fast heart rates, really slow heart rates, or the heart could dilate and become abnormal over time.
Sarah's heart looked healthy. Still, doctors dug deeper, looking for damage at the cellular level.
If we see abnormalities, that points us in the direction that there could be early myocarditis and there may be a need for further testing.
For now, all clear.
It does make me feel at ease. Obviously, it was super concerning because I had never had any problems before.
And he said if, 2 to 3 months down the road we're still having some questions or issues, then come back and we can definitely look further into it. But right now he gave her, from his standpoint, a clean bill of health.
We should still continue to watch them, okay, because this is still a new virus and we still don't know exactly how they might look 2 or 3 weeks after they recover, so we shouldn't completely close the door on the possibility of a heart issue.
Dr. Robbins says the majority of patients who develop viral myocarditis go on to make a full recovery, but about 25% can have long-term heart malfunction. Early diagnosis and the proper medications are key.
All right, Dina, thank you.